you are applying the same. So once you start analyzing the questions, then things would become easy. So remember, whatever you know, it's enough, but make sure to apply the same knowledge. Okay. So let's start with the definition of the laser. Okay. So hope guys, this is clear to you, Aisha, Sayuj. Hopefully we are going live as well. So I think everything is fine, correct? Thank you. So the definition of the laser, as we all know, it is light amplification by simulated emission of radiation. So the thing which we are going to do is, which you need to know for the exam. Otherwise, it doesn't make any sense to talk about things which are not so important. So first and foremost, classification of laser. As you all know, classification of laser based on the state, whether it is solid state, whether it is gas, semiconductor, liquid free, and metal. But for the exam purpose, you need to remember neodymium or NdArc lasers, which are solid state lasers. So the SPA would come as neodymium lasers are which type of laser? Solid state, gas, semiconductor, or liquid. So you know the answer as solid state. Now, what is the basic principle of laser so that you would be able to understand? Basically, as you can see, the laser device actually emits the photons, which is actually through a process of vaporization, simulated emission. So it goes through a lot of things, and the natural effect, what you're going to get, is going to cause a sterilization effect. So one thing is, it causes in the excited state, these photons tend to do a couple of things. One is a sterilization. It is going to kill bacteria and viruses which are harmful. And also, most important thing, it decreases the post-operative pain because it's going to seal the nerve endings. That is the reason whenever you get the laser surgery, it is less painful. Again, as I mentioned, remember NdArc is a solid laser, which is very important. Now, let's talk about carbon dioxide laser. If you have met your dermatologist or if you have a friend who is dermatologist, you could know that these carbon dioxide lasers are used to treat sun damage, wrinkles, scars, warts, and to erase the hemangiomas and things like that. And very important to remember, based on the wet, it is invisible to human eye. Okay, so definitely this is something which your dermatologist friend would be using. But why are we not using it for laparoscopic surgery? Because you know, the laparoscopic surgeries, you need the depth to be more. When the depth is limited, so carbon dioxide laser cannot be used. That is the reason this is not used for laparoscopic surgery. Okay, hope I am clear so far. So if you have got, if it is clear, people, whoever has joined me for the live, thank you so much. I could see so many of you have joined for the live. You can drop a message clear so that I know that you are all with me. Fantastic. So I would want you to interact in the chat message so that I can clear if you have any doubts. Now coming to the NdArc laser. NdArc laser, as I said, solid state lasers. Basically, this one is very important point. It is a high energy beam in IR spectrum, that is 1064 nanometer. Remember this value, guys, because this comes again as a single best answer. Okay, so this one can be transmitted down a fiber optic cable. So this can be used for hysteroscopic surgery because you can utilize this energy into the fiber optic cable. Of course, this provides good cutting and hemostatic effects. So this is the best one to use in hysteroscopic surgery. When you come to laparoscopic surgery, obviously, if it is causing hemostasis, it must be used in laparoscopic surgeries. However, it is not so useful in laparoscopic surgeries because whenever you use in lap, the beam should be with the tip. Right? So because you don't want dissemination of energy, it has to be pointed towards the tip, which is not possible in case of NdArc laser. And one more very important thing which you guys need to remember is people, whenever they use, the health professionals and the patients, they need to use protective goggles. Okay, this is very important to as a protective measure. Now, this is again one more important thing. radiation which are non-ionizing and ionizing, but which is the body which controls this? Okay. So you need to remember, because this comes as an SBA, that is the reason I've added an independent non-profit organization, that is International Commission on Non-Ionizing Radiation Protection. This is the one which provides the scientific evidence on how much radiation is correct for the people, so that it will be which one is detrimental for the environment. So this is again single best answer. That is the reason I have given. Remember, ICNIRP is the one which talks about the limits. Now, what do you mean by Tesla? We all know Tesla cars, but Tesla is again one of a very commonly asked single best answer. Okay, guys, if you are clear so far, you all can type clear in the chat box or send me a heart. So I know that you are all clear so far. Coming to Tesla. What do you mean by Tesla? What does this measure? This is an SI unit of magnetic field. That is what this comes again as single best answer. So remember to, whenever you think of Tesla cars, remember it is the SI unit of magnetic field till you finish your exams. Now, what is the relationship between hydrogen ions and MRI? So remember, hydrogen ions are the one which are used in MRI. Okay, and MRI is called hydrogen imaging because human tissue, as you know, it contains mostly water and fat, which has hydrogen ions. So these also hydrogen ions, you know, it is H plus magnets, which are actually, which act like the magnets. So that is the reason this is the main one which is sensitive for the MRI. So that is the reason you will be using hydrogen ion. Again, guys, this is a very important single best answer. Okay, you get around 4 to 5 questions or less than that, which I have covered in these, which I'm going to cover in this. Okay, so again, what is the MRI principle? Basically, whenever these hydrogen ions keep on spinning, they act as magnets. They're weak magnets, but they do act as magnets. And these, once they start spinning, they can be aligned in an external magnetic field. Obviously, we are not radiologists. You need not know very well. But remember, once they align, then what you get, a reflection in quantum mechanics, basically as an image, that is what you see. Okay. And one important thing, remember, MRI is used for softer tissue. For example, in cancers, in CA endometrium, you use MRI of pelvis as the more diagnosing. But when you go to the ovary, you want CT scan is the best one when you come to that. Okay. So I hope I'm clear with this. Remember, you need not think of remembering too many things. One is the hydrogen ions. The next one is you need to remember it is basically used most for a soft tissue, especially example of C endometrium. Now, this is also one of the questions for different procedure. What is the average effective radiation dose? For example, if you think of head, it is equal to 8 months of background radiation. CT spine, it is equal to 2 years. CT chest, 2 years. So do you need to know everything? Actually, in the previous exam, they have asked CT chest. For example, in case of choriocarcinoma, if you're suspecting in X-rays, you will be going CT chest, or even in PET CT whenever you're going to do. So you need to counsel the patient. Remember, it is equal to 2 years of background radiation. Again, this is a single best answer. Okay, so just remember that. Okay, again, this is a very easy question. So thank you, Sarika and Sowmya, for your wonderful comments. Keep on putting it if you have got any doubts. Now, the frequently asked questions, which I'm going to ask again. The standard chest X-ray is equivalent to what duration? Probably while you're counseling patients, they ask, okay, I can get the chest X-ray, but what is the duration with which I feel how safe it is? You can always say, if you think of 3 days of normal background radiation, that is what it leads to. Okay, so that is again very important. Next, which is the imaging techniques gives maximum radiation exposure to the patient during checking tubal patency? Because you have a lot of investigations. One you have HST, one you have hysterosalpingography, you have laparochromoperturbation. Obviously, hysterosalpingography, because you're going to inject the dye and you are going to take photographs of the multiple times. So that is the reason this has been given more, this causes more radiation exposure. Which imaging modality would be choosing to check growing thyroid nodule in pregnancy? Obviously, first thing which you do is ultrasound, guys. That is the most important first test to detect any thyroid nodules. Depending upon the pattern, monitoring the growth, you would be thinking of further tests. Next, what is the threshold for ultrasound frequency? It is 20 Hertz. So you need to remember this because these are factual recalls. If all of you have been clear for these set of questions, please type S or clear. So I know that you're all with me. Thank you so much, guys. So many of you are watching live. That's really awesome. So if you are good so far, you can type clear in the chat box. So I know you're all with me. Fantastic. So let's move on. The next thing you would be getting, many times I've seen people struggling with ultrasound images. First, let's think about what are the things which mentions anechoic, hypoechoic, hyperechoic. Hypo is, it is less than normal, hyper is more, and anechoic is this. So you would usually be getting these things like what is anechoic. Okay, so thank you, Aisha Javed. Thank you so much for putting that comment. Thank you. Thank you, Sarika. Thank you, guys. So what do you mean by anechoic? Anechoic is nothing but the one image, like if you are doing a very regular scans, you can see bladder, it would be like this. This is anechoic, okay? So you can see gallbladder, urinary bladder, or any cyst could be black. Otherwise, generally, this is how your 2D scans look. Anechoic is without echoes. So obviously, they appear black. So if you know this, this is really awesome, okay? Because this is again a single best answer. What do you mean by anechoic, okay? Now, what is the principle of ultrasound? I am sure you would all be knowing piezoelectric effect, okay? Whenever any particle is subjected to mechanical pressure, there will be an voltage which would be generated and that would be reflected on the screen. This is, we are talking about the 2D ultrasound. Of course, I'm not talking about the Doppler effect. That's a different story. So let's move on to, if you remember this, there's a piezoelectric effect. I think that is more than enough. Okay, next move on. The difference, what is this question, guys? Okay, so what is the difference between peak and baseline of ultrasound wave? What do you call it? The difference between the peak and the baseline of ultrasound wave is called what? Because you know that it is a wave which comes in, right? So they are asking you what is the difference between the peak and the baseline of the ultrasound wave. So anybody who knows this answer can type in the chat box. Definitely, this is something which can actually, this is again a single best answer. Obviously, this is something to do with probably I would say for the radiologists, but these questions are asked. That is the reason I have given this. And so I hope you are all answering. Obviously, the correct answer is amplitude. Fantastic, Yashaswini, well done. So that is a correct answer. Amplitude, this is called amplitude. Now, let's move to the probes. What do you mean by different types of probes? Obviously, you all know this is a transvaginal, curvilinear, linear, and phased array. Now, you need to remember the frequency of the transvaginal probe because, again, this is something which they would be asking for as a single best answer. Okay? And you need to know transabdominal is a low frequency probe. Transvaginal is a high frequency probe. Okay, so obviously transabdominal scans, because it's a low frequency, it might not be able to penetrate in the obese patients. Okay, so in the obese patients, you always use transvaginal scan. And remember, in case of any ovarian cyst, it's always good idea to transvaginal scan if they are sexually active. So again, these two questions you need to know because these are the ones which are commonly asked. I hope this is clear to all of you. I could see everybody has got the amplitude answer correct in the chat box. Fantastic, guys. Thank you so much. Let's move on. Electrosurgery frequency. Again, this is something I'm not going to talk about. What about the cutting mode and coagulation mode because that becomes too much. So, but remember the frequency. It is the kilohertz, which you will be 500 kilohertz in actually electrosurgery, which you will be using. Okay, that is again a factual recall. Now, what is this ultrasound image? I'll give you a few seconds for all of you to answer this. What is this typical image talks about? What is this typical image which is seen on the screen, guys? What is this image which you guys can see? So let me see how many of you will be getting this correct. Let me check how many of you will be getting this image of ovarian cyst. Okay, I can see lots of answers coming in. Yashaswini, fantastic. What is the typical appearance? Very good, Aisha. Ground glass appearance. The classical ground glass appearance. Okay. This is due to the hemorrhagic debris. It is not an hemorrhagic cyst. This is due to the bleeding which is happening inside the ovarian cyst, which looks very typical ground glass appearance. Fantastic, guys. You're all doing really good. Now, let's move to the next one. I hope this is clear. This is a case of endometrioma. Again, you will have a single best answer based on this. This is how the typical ground glass appearance. Now, okay, what are we dealing in this image? Let me give you a few seconds so all of you will be able to answer. Okay, so again, this is a transvaginal scan. Okay, where you can see two things. So what is this? What is this image is all about? What do you think? What is happening here? Because there are two things which you are seeing. So what is that? What is this? And what is this? Okay. So you have to name A is this, B is this, because in the chat box, I could see again, some of you are answering. I don't know whether you are answering the previous ones. So if you could name this is A and this is B, I think things would be easier. Okay. Let me wait for a few seconds. Okay. So what is this A and what is this B, guys? Said, hope you are able to see my screen in the live, correct?
Yes, ma'am.
Okay, guys. So let me check. Okay, I could see Yashaswini answered this as a simple cyst, and this was cyst, solid mass, and it's a simple cyst. Okay, so let me wait for a few more answers. Fantastic, you guys are really doing good. You are trying. There is some errors which I will correct. Fantastic, Sowmya. Sowmya and I are fantastic. Okay, probably see. Okay, let me show you what this is. Okay. Basically, when you see this, whenever you see this reticular pattern, it is hemorrhagic cyst, but this is dermoid. It's already given here, basically, guys. Okay, if you read this, because you have both the things here. This is the solid component which you are seeing, and there are a lot of calcifications. Generally, if you see the tooth, actually, the tooth is something which is clearly seen. Whenever you see this with a very complicated one, of course, the 100% diagnosis is from your ultrasound. This is a case of dermoid cyst. Fantastic, well done. This is definitely not a simple cyst because of these additional solid components. Okay, hope this is clear. You can type clear if you are good so far. Okay, and again, this would be a single best answer. Now, what is this very, very typical of reticular lace pattern, where you are seeing a lot of reticular lace pattern. So what type of cyst is this, guys? This is again a very, very commonly asked. So what type of cyst is this? So I'm just waiting so that you all will be able to answer. Fantastic. Thank you for the comments, guys. Yeah. Okay, what is this cyst, guys? Okay, I can see the answers coming in. Hemorrhagic cyst. Okay, any other different answers? So do you think it is endometrioma or hemorrhagic cyst? Okay, you're all doing fantastic, guys. This is a very typical hemorrhagic cyst. So obviously, I think this you need to remember whenever you see this cyst, which is typical reticular lace pattern, you need to remember this would be something to do with the hemorrhagic cyst. Fantastic. Now, very well done. Hope that is clear. If it is clear, just drop clear so that I know that you are all very clear with what I'm actually explaining. Okay. Fantastic. So let's move on. Let's move to the next case where an 18-year-old with chronic pelvic pain with white discharge per vagina. And this is the one which you are seeing. Okay. So what is the diagnosis? What is this diagnosis? Because when you get these type of scenario based, you need to be able to differentiate the different ones. Okay. So what is this, which is with a chronic pelvic pain, that is the key, with white discharge per vagina. I know this could be little tricky and probably not so clear, but this is something which you guys need to know. Okay, so let me show this because this seems to be a little tricky. This is tubo-ovarian abscess. I know with this probably it might be difficult. They could have given you the other side of it, but this is how the tubo-ovarian abscess looks like. Okay, is that clear, guys? Is that clear? Am I clear so far? I know this is difficult because it is not the complete sagittal and anterior posterior or the coronal plane. If they give, it is easier. Okay, this is definitely not endometriosis because you can see a lot of multi-loculated things. And you can see it is not a ground glass. It is neither looking like a hemorrhagic cyst nor an endometrioma. So when you actually move around, you'll be able to see. Don't worry, when you see the next one, it would be easier for you to understand. Okay. The next scenario, again, this would be able to, you will be able to understand and probably clarify the previous image as well. Mrs. F, 32-year-old, has presented with primary infertility. She gets regular periods. Partner semen analysis is normal. Day 21 progesterone is 45. So you know that she's ovulating. She's given history of PID when she was young, treated completely. So what's your diagnosis, guys? What's your diagnosis? When you have a long, probably this image is a very, very typical of a diagnosis. What do you think? What is happening? I'll give you a few minutes for you guys to do. Have a look. Yes. Okay, I'm just waiting for all of you to answer. Fantastic, Sowmya. I think you are really good with the images. Any other opinion? Because when you see, this is how actually you will draw. Okay, this is a very, very, very typical case of hydrosalpinx. Well done, fantastic. So I think people who do this regular scans, it's very easy for them. Okay, so again, this is how your image actually should be looking in TO abscess as well. Okay, fantastic guys, well done. So you can see the image. This is a very lobulated and lengthier ones you will be getting. This is not 100%. This is not nothing to do with your probably ovarian cyst. When you see this typical elongated one, always think of hydrosalpinx. Okay. The next one. Mrs. Jessie, 43-year-old, is here in clinic for her routine checkup with physician as she is hypertensive and diabetic. Her BMI is 32. She has abnormal uterine bleeding and image shows intracavitary previously treated for endometrial polyp. So image shows intracavitary echogenic area. What is the ultrasound diagnosis? What is the ultrasound diagnosis of, this is obviously an endometrial cavity. This is a transabdominal scan. From the outlook, you can say this is a transabdominal scan. This is the endometrial cavity in which they are seeing this. So what is this which you are dealing with? Definitely when you have already so many risk factors, you would be already knowing. Fantastic, Aisha. Fantastic, Sowmya. Well done, guys. So this is endometrial polyp. Okay. So basically, whenever you have things like this, I'm sure biophysics specifically remember the different types of lasers and then principles of MRI, which ion is used, and a bit about probably the ultrasound probes and the images. Because when you get this, obviously this could be part of data interpretation. I'm sure you will all be fantastic. All the very best. I took this topic, there's a small one, but I wanted all of you to know because this can carry a lot of marks. Okay, so because when you know these things, these are easy scoring one. I hope all of you will clear this exams, upcoming exams. Just give with the confidence and be kind to yourself. You would all be fantastic, and all the very best to all of you. It was really fantastic for the people, whoever has joined in the live, to chat with all of you, and you're all doing really good. Thank you so much, and don't forget to drop your feedback, how useful this was. All the best, and take care, guys. God bless. Thank you so much. Thank you, and stay blessed. Bye-bye.